Welcome and thank you. Thank you is the most important thing I can say today as far as taking control of your health. Thank you for being here. Thank you for considering Denali. We're really excited to have you here, and I really think we have something amazing to offer. Hi, I'm Dr. Earl, and I'm the medical director for Denali Medical Center. And we really have a unique way of looking at headaches because we have so many tools that can help. So with that, let's take you on a little perusal of what we do. First, understand we follow all the guidelines. We want you to be safe, and certainly we want to be safe. We take the time to listen, understand, and really figure out what's going on with your headache. And then we'll come up with a plan that helps you get better. Our caring staff will help you along the way in your quest for health and wellness. So, our focus today is headaches. Now, I must admit, I've come a long way, and this is embarrassing for me to say, but when I was first trained on headaches, see, I did 16 years of emergency medicine, and I was trained that anything in front of the ear is migraine or migraine-like, everything behind the ear is related to tension headaches, and everything else, well, you just give them pain pills and hope they go away. But the reality is they don't. You're here because you understand there's a lot of variety and a lot of different things that could trigger headaches. Fortunately, I was given the blessing and opportunity to keep training, learning, and growing, and it's evolved into headacheology, the study and understanding of headaches. So we then started looking a little bit deeper. What causes headaches? And certainly inflammation, traction. This means tension that's in your neck due to inflammation, muscle contraction, and vascular type headaches. All of these things play a role. And then we look at how we can maybe cluster different headaches in different ways. For example, sinus headaches. They present often, not always, but often in the face. Cluster headaches are around the eye. Tension headaches and neck headaches can refer their pain that originates in the neck to the back of the head and the scalp. Again, a different version of tension headache is across the forehead. Migraines tend to be on one side or the other, but not always. There's a Todd's migraine that actually causes paralysis of an extremity. And then TMJ pain will often give you headaches on the side of the temple. Well, because we started looking at headaches differently and really understanding what we could potentially do about them, we came across some very exciting data and news, and that is that there is this cluster of nerves back behind your face, if you will. It's a space called the pharyngeal and retropharyngeal space. So that means the pharyngeal means the area behind your nose and your mouth, and the retropharyngeal means the space behind that. So we're talking back. But anyway, the reality is there's a whole complex of nerves that are in that area. One of the very important ones that we will talk a lot about is the sphenopalatine ganglia. But I want you to understand, even though the sphenopalatine ganglia is very important, it's not the only nerve that is in this area. And you can also see that this sphenopalatine ganglia connects with a whole host of nerves, including your vagus nerve, the facial nerve, and the list goes on and on. It's all interconnected. And you can see here that sometimes those nerves go very deep, and then they're connected to other tissues and organs in your body. And it goes deeper still. And so we can really start to affect these nerves and how they interact. Well, one of the things that we learned early on was that these nerves are encased or surrounded by bone. And this area here probably shows it in one of the best ways. But the reality is a lot of these nerves are enclosed by bony borders. And that means that if they swell, get inflamed, if they feel overused or otherwise, they don't have a lot of room to swell, change, or get inflammation. And so when that happens, because it does and will happen, the only thing they can do is send out a pain signal. Well, that's a nerve pain signal, and it is excruciating and debilitating. Well, here at Denali, we've been introduced and actually have modified and improved on something we call a sphenopalatine reset. Now, we focus on the sphenopalatine nerve, but the reality is we can affect all kinds of nerves in the back of the face and head. Be that, again, the ganglia that are back there, the trigeminal nerve, and the list goes on and on. But we will focus, as we discuss this, on the sphenopalatine ganglia. So we put a small catheter into the nose after numbing, so it's hopefully as comfortable as possible. But we put a small catheter into the nose and then introduce a little bit of medication into that area. Then we allow it to drip and absorb back into those deep areas of the face. The result is decreased inflammation and a reset of these nerves as they then exist in that area behind your face and nose. Well, to take our headaches a little bit further, understand that there's a huge amount of crossover that takes place between your head, your neck, and the other tissues in this area. And so sometimes you may have a headache that's in a certain area, and it seems very specific to you, but the origin may be somewhere else. And this really outlines a lot of the crossover that happens between the nerves of the face, the neck, and so forth. And so it can get rather complicated. In fact, they have a whole series of headaches called cervicogenic headaches. Cervicogenic headaches. Cervical means cervix or neck. Those are the cervical bones. Genic means it starts there, and headaches. And you can see that often they will refer to the jaw, the base of the skull, and even the temple. And you may have headache across this entire arc. So it's important as we start talking about headaches, not only to have the sphenopalatine reset available to us, but also treatments that can treat these tension type headaches or neck generated headaches. And there are many of them. We have a great understanding of the neck, and we've been doing neck injections for many years. And these injections that we provide are safe, effective, and do a great job at healing the tissues, and I should say getting the body to heal the tissues in the neck so that it decreases and even reduces, if not eliminates, the pain. We're very careful. We understand the anatomy. We understand how to get into the areas that are safe. The reality is, based on the angles and the approaches that we take here at Denali, these injections into the neck are the safest, some of the safest that we do. And the reality is we understand these tissue layers called fascial layers, and that's where we deliver the medication so that it gets to where it needs to be without causing significant trauma to the tissues. One of the other things that's very important in regards to headaches is understanding the vagus nerve and all of the tissues that are influenced by the vagus nerve. You see, this vagus nerve then passes through that retropharyngeal space that we talked about. And so that's why sometimes certain foods or hormones or certain emotions or situations may cause you stress and lead to a headache. And it's all interconnected through the vagus nerve that then passes through that very narrow area back behind your face that may not be able to handle all of the swelling and all of the information that comes from the vagus nerve. And so again, we're able to address this and reset it. Finally, one of the very core principles that we need to discuss is the TMJ, the temporomandibular joint. This is the joint that's allowing me to talk. It's the one that allows us to open our jaw, to eat, and do those type of maneuvers. Well, here's what's interesting about this, is the fact that the TMJ joint doesn't act like many of the other joints. It's a sliding joint, not a pivot, not a rolling, it's a sliding joint. And so what happens is that those bones slide across each other across a disc. Well, understanding this principle changes where you deliver the medications. Many of the treatments for TMJ address the back of the TMJ joint, which is back here. And the reality is most of the problems, arthritis and breakdown, will be on this motion area, which is from the midline forward. And so it's very important to address this correctly. That's still just really cool. Well, at Denali, really, getting you well is the highlight of what we do. Certainly, we understand that these pains, this discomfort has changed your life. And the reality is, many of us have lived them or lived through them. We have family members. We have people we care about that that their lives were altered because of the pain that changed their lives. And because of that, we are driven to find the best treatments possible. And that's what we do. And we want to deliver that to you. And the reality is, we care about you, we care about our health, and we take it very personally. I really think you've hit the bullseye in regards to headache care. And welcome, and thank you from Denali Medical.